Top story tonight, local disease specialists break down what East Tennesseans need to know now about the coronavirus.
The outbreak starting in Wuhan, China, with 2 confirmed cases in the U.S., in Washington State and Chicago. Just over 60 people are being tested for the virus in our country, and airports that fly internationally are stepping up screening for travelers who may have been exposed.
Joining us now here in the studio, 6 on Your Side reporter Madison Keevy. So Madison, I know you've spoken with local experts. What is the message now for East Tennesseans?
Yeah, Bo, the big takeaway here is to be educated, stay up to date, but the immediate health risk to the general U.S. public is low as of right now, unless you fall into those specific categories of traveling to China within the last month, or you've been exposed or around someone who's recently made that trip. There's a better chance you'll contract the flu this season than this strain of the coronavirus.
It's a group of viruses. They cause common human respiratory illness.
The coronavirus at the center of international concern is a new strain, one that was first reported in China.
The typical coronavirus infection is just stuffiness, cough, sneezing. What they're seeing in China has been severe cases of pneumonia, and a few patients have died of it.
In East Tennessee, infectious disease experts are staying up to date about potential impacts in the U.S. One of them, Covenant Health infection prevention specialist, Dr. John Adams.
Factor that against the tens of thousands of cases of influenza and hundreds of deaths already this year from influenza, which is a very common illness, and we're right in the middle of a nationwide outbreak of that virus.
Adams says East Tennesseans should stay up to date, too, on what the CDC's finding.
At this point, I wouldn't really change my plans. There's really not enough information to say that just normal activities in our area would need to be modified.
Dr. Mark Rasnick is the infectious disease specialist at UT Medical Center.
Kinds of things we would use for a suspected case of coronavirus would be a combination of the practices we use to prevent MRSA spread, to prevent spread of things like tuberculosis, and to prevent getting splashes in our eyes of infectious body fluids.
Rasnick there talking about UT Medical's preparedness, and he adds that UT Medical wouldn't be doing anything new when responding to any outbreak, but they would use the same things that they use every day in that different combination. Now keep in mind, this is a respiratory illness we're talking about, usually passed through the mouth, nose, or by coughing and sneezing. Bo and Lori.
All right, Madison, thank you. New suspected cases, by the way, keep cropping up around the U.S. You know, at 4, we told you about one in Raleigh, North Carolina.
Well, since then, another suspected case has come to light, this time out of Waco, Texas, a Baylor University student who recently traveled to China. But again, health officials say there is little risk to people on campus.
And even closer to home. A student at Tennessee Tech being tested for the virus due to mild symptoms and their recent travel history.